So Protexin are very excited to be here at the Digestive Disease Week 2018 in Washington, DC. We've had a poster accepted for our latest human clinical trial in irritable bowel syndrome type D, diarrhea predominant IBS. So I'm just going to take you through a bit of the study here. Now, the majority of the studies in IBS at the moment are actually very, very small in size and should really be considered to be pilot studies. Therefore, their outcomes aren't necessarily applicable to clinical usage. So what we did in this study was use robust biomedical statistics to calculate the number needed to treat to have a benefit here. So what we found was that we needed to have at least 270 patients. What we actually did was randomize 400 and we had 360 that completed the study. This was using a complex probiotic, so there's 14 different strains from 5 different genera. Again, the research in this field suggests that actually multi-strain formulas have the most clinical significance. So we looked at the primary outcome being improvement in abdominal pain. And what we found was that a near 70% reduction in abdominal pain by the end of the 4-month treatment, and this was persistent up to month 5, which is a month after we completed the treatment. Other things that we looked at were bowel movements. Bear in mind this was IBS diarrhea predominant. So at baseline, patients were having 6 episodes of diarrhea a day, and by the end of treatment we reduced this to 2.5. And also we assessed using the IBS severity scoring system that you can see here, and IBS quality of life, which data is not shown here, but these are 2 validated scoring systems that haven't been used in all studies, but there's a call for these to be used because they're very robust and validated measures. So again, for IBS quality of life and IBS severity scoring systems overall, we showed significance at all time points compared to placebo. So we hope that this will be able to be a treatment for IBS D patients and offer solutions for long-term care.